Welcome to this Step 3 review on immunizations and travel medicine. This video is brought to you by Roadmap to Residency. Vaccine and travel questions are some of the most predictable points on the entire exam. Because the stems are built from a small set of repeating patterns, our goal today is not to reteach every schedule. It is to show you how these stems are constructed and how to attack them. Keep your question bank and a trusted review resource open alongside this video, because these patterns lock in through repetition. Let us get started. Here is what we are going to cover. First, we will learn the 4 stem types that carry almost every immunization question on this exam, and how to sort a stem into one of them within seconds. Second, we will attack travel medicine and prophylaxis questions by hunting for the single trigger detail that decides the answer. Third, we will work through practice questions together and explain exactly why each answer choice is right or wrong. This video assumes you have baseline knowledge from the preventive medicine and infectious disease sections of your review resource. We are here to sharpen how you take the test. Our first strategy is to sort the stem into a type before you read a single answer choice. Start by finding the deciding variable. Every vaccine vignette hides one detail that actually decides the answer, and it is almost always age, a chronic condition, pregnancy, immune status, occupation, or a travel destination. Circle that detail. The rest of the paragraph, the normal vital signs, the reassuring physical exam, the social history, is decoration designed to eat your clock. Then name the type. Nearly every question you will see is one of 4 kinds. Which vaccine is due today? Which vaccine is contraindicated in this patient? What prophylaxis does this traveler need? Or what do we give after this exposure? Once you name the type, you know which rule to reach for, and the answer choices sort themselves. Strategy 2 is the live vaccine trap, the highest yield pattern in this subject. First, recognize the contraindication question in disguise. When a stem mentions pregnancy, an organ transplant, chemotherapy, high-dose steroids, or advanced human immunodeficiency virus infection, the test is asking a live vaccine question, even though it never says so. Spot the flag first, then decide. Your review resource lists which vaccines are live in its preventive medicine chapter, and that shortlist is worth memorizing cold. Second, do not confuse sick with immunosuppressed. A mild illness, a low-grade temperature, or a course of antibiotics does not stop a vaccine. Test writers plant those details, hoping you will delay. Delaying vaccination in a mildly ill patient is one of the most common wrong answers on this topic. Strategy 3 covers travel and prophylaxis stems. First, the destination is the question. The country, the season, and the itinerary are not scenery. A rural stay, a long trip, or a visit during rainy season raises risk and changes the answer, while a 2-day urban business trip rarely needs an aggressive regimen. Match the intensity of prophylaxis to the actual exposure. Second, timing beats content. A huge number of travel stems turn entirely on when the patient is leaving. A traveler departing tomorrow cannot complete a multi-dose series, so the answer shifts toward whatever still helps in the time remaining. Always find the departure date before you look at the choices. Third, beware the everything answer. One option will offer every vaccine and every medication at once. It looks thorough and it is wrong. Proportionate care beats maximal care on this exam, exactly as it does in clinic. Let us work through our first practice question, and this one is a post-exposure prophylaxis stem. A 28-year-old man comes to the clinic 4 hours after a stray dog bit his forearm while he was hiking. The dog ran off and cannot be found or observed. The wound is a shallow puncture and has already been washed. He has never received rabies vaccine before. His last tetanus booster was 3 years ago. His vital signs are normal. The question asks for the most appropriate next step. Find the deciding details before you choose. Read the 4 options and pick your answer, then we will walk through the reasoning together on the next slide. Let us break this down. First, spot the pattern. 2 details decide the question. The animal cannot be observed, and the patient has never been vaccinated against rabies. That combination means full post-exposure prophylaxis. Notice the tetanus booster from 3 years ago is decoration. It is current, it changes nothing, and it is there to make you hesitate. Second, apply the rule. A previously unvaccinated patient needs both passive and active protection, meaning immune globulin plus the vaccine series. Third, eliminate. Vaccine alone is the trap written for the previously vaccinated patient, and he is not one. Immune globulin alone leaves him with no lasting immunity. Waiting for symptoms is fatal reasoning because symptomatic rabies cannot be treated. The answer is immune globulin together with the vaccine series. Your review resource covers wound care and timing in its infectious disease chapter. Here is our second practice question, and this one is a travel counseling stem. A 35-year-old healthy woman comes to the clinic for advice before a 2-week trip to a rural area of a developing country. The key detail is that she leaves tomorrow. She plans to stay with a local family and eat local food. She is not pregnant, takes no medications, and her routine vaccines are up to date. The question asks for the most appropriate next step. Notice the destination, the itinerary, and above all, the departure date. Pick your answer, and we will reason through every option on the next slide. Let us work through this. First, timing drives everything. She leaves tomorrow, so no multi-dose series can be completed, and the exam is testing whether you will still act rather than freeze. Then read the itinerary. A rural stay, local food, and a 2-week duration point toward hepatitis A risk and malaria risk in an endemic area. So why does doing something beat doing nothing? Give hepatitis A vaccine now, because a single dose gives meaningful protection for a healthy adult, and start malaria prophylaxis with food and water counseling. Now eliminate. Postponing the trip is almost never correct and punishes you for being overcautious. Vaccine only abandons her malaria risk. Serologic testing wastes the 1 day she has left. The answer is hepatitis A vaccine now with malaria prophylaxis and counseling. Let us look at post-exposure stems as a group, because they share a skeleton. First, ask what kind of exposure this is. An animal bite, a needle stick, and a sexual exposure each have their own rule, so sort the exposure first. Then ask 2 questions. Is the source known, and was the patient previously vaccinated? Those decide most of these answers before you read the choices. Second, for human immunodeficiency virus exposure, the exam rewards starting prophylaxis promptly rather than waiting on source testing. Any choice that delays protection to gather more information is usually the trap. Draw baseline labs, begin treatment, then adjust when results return. Whenever a vignette tells you how many hours have passed, that detail is doing work. Here is our third practice question, and it is a post-exposure prophylaxis stem with a clock in it. A 26-year-old medical resident sustains a deep needle stick from a patient with known human immunodeficiency virus infection who has a high viral load. The event happened 1 hour ago. She washed the site immediately. She is healthy, not pregnant, and takes no medications, and her hepatitis B vaccination series is complete with documented immunity. The question asks for the most appropriate next step. Pay attention to the source, the clock, and her documented hepatitis B status. Choose your answer, and we will reason through every option on the next slide. Let us break this down. Every detail points the same way. A deep stick, a source known positive with a high viral load, and only 1 hour elapsed. This is a high-risk exposure well inside the window where prophylaxis works. Start antiretroviral prophylaxis now and draw baseline testing at the same time, not in sequence. Now the key distinction. Waiting for her baseline result burns the window, and that is the delay trap. Hepatitis B immune globulin is wrong because her series is already complete with documented immunity, a detail planted to see whether you read it. Reassurance ignores a high-risk exposure. The answer is to start prophylaxis now and draw baseline testing. Here is a pearl that ties everything together. First, read the patient, not the paragraph. Skim for the deciding variable. Age, pregnancy, immune status, chronic disease, occupation, or destination. These stems are padded with normal vital signs and reassuring exams, and that padding exists to burn your clock. Read straight past it. Second, predict before you look. Name your answer before reading a single choice. If your prediction is on the list, take it and move on with your time banked. If it is not, you misread the question type, so go back to the deciding variable instead of letting a distractor talk you into it. These are among the fastest points on the exam. That wraps up our review of immunizations and travel medicine strategy. Remember the core ideas. Sort every stem into one of 4 types and find the deciding variable before you read the choices. Recognize the live vaccine trap whenever pregnancy or immunosuppression appears, and never delay a vaccine for a mild illness. On travel stems, let the destination and the departure date drive your answer, and refuse the everything option. On post-exposure stems, ask what kind of exposure, whether the source is known, and whether the patient was previously vaccinated. Lock this in by drilling questions under timed conditions alongside your review resource. Visit roadmaptoresidency.com for expert tutors and residency advisors who can help you build a personalized study plan. If this video helped you, please like and subscribe so you do not miss our next board review session. Good luck on your exam.